Welcome to Aging in Recovery. I'm Gil Singh Trong, licensed master social worker and founder of Never Alone Home Care Services Incorporated.
Some people have been asking me whether, given what's happening in the United States right now, attacks on civil rights, immigration crackdowns, book bans, attacks on DEI, diversity, equity, inclusion, growing political division, whether there's really room anymore for a conversation about aging and recovery. I understand that question. Because for many of us baby boomers, what's happening in this country today feels real strange, real familiar. We lived through another period of enormous social upheaval during the 60s and 70s. Back then, people were marching for civil rights, women's rights, students' rights, immigration rights, environmental justice, and yes, gay rights. People were protesting the Vietnam War. Young men burned their draft cards while women burned their bras. Young people were questioning authority and demanding social change. Today, we look back and call that period a social revolution. But for those of us who lived through it, it did not feel romantic. It felt chaotic, divided, oppressive, emotionally draining, uncertain, and violent. Much like what's happening today. And during that same era, the so-called sex, drugs, and rock and roll generation, the Woodstock and Motown era, many people also became caught up in drugs and addiction. For some people, it began recreationally, experimentally, socially. But for many others, addiction became devastatingly real. And as the social unrest of the 1960s moved into the heroin epidemics of the 1970s and the crack epidemic of the 1980s, urban communities throughout the country, Harlem, Watts, Chicago, Philly, Baltimore, Los Angeles, just to name a few, were overwhelmed. Many people did not survive those tumultuous years, but many did. And honestly, that's the part society rarely talks about. Millions of Americans eventually found recovery. They rebuilt their lives, established careers, raised families, went to work every day, opened businesses, became parents and grandparents, built recovery communities, and helped other people recover. And now, that same generation is aging. Today, many of the people who survived the drug epidemics of the 1960s, 70s, and 80s are now in their 60s, 70s, and beyond. They survived all that chaos. They survived addiction. And now they are aging in long-term recovery. And this is not a small population either. The Substance Abuse and Mental Health Services Administration, or SAMHSA, and other federal researchers have spent years warning the country about the growing number of older adults struggling with substance use disorders. One SAMHSA report, A Day in the Life of Older Adults, discussed the rapidly increasing number of older adults either needing treatment or already receiving treatment for substance use disorders. And those statistics matter. But as I've been discussing, my focus goes beyond the treatment population. My focus is on something I believe has remained largely invisible inside both aging services and addiction systems. The millions of people already living in long-term recovery. People with 10, 20, 30, 40, and even 50 years of clean time. People who survived addiction, rebuilt their lives, and quietly aged out of public discussion. In many ways, I believe this is an invisible cohort. As I've been saying, addiction is public, but recovery is invisible. Once people stabilize in recovery, society often stops paying attention to them. The systems focus on active addiction, crisis, overdose, relapse, emergency rooms, incarceration. And again, those services remain critically important, but very little attention has been given to what happens after decades of recovery, especially as America itself continues aging. As the general population grows older, millions of Americans will eventually require some level of support due to physical decline, mobility issues, chronic illness, cognitive impairment, isolation, or the simple realities of aging. And this is true for everyone. But for people aging in long-term recovery, there are often additional layers that many traditional aging systems just do not fully understand. Histories of trauma, PTSD, incarceration, family estrangement, grief, loss, years of instability. The emotional and physical consequences of addiction itself begin catching up. And just because they've been functioning in society, having careers, having great jobs, establishing families, does not exempt them from the consequences of their past active addiction. Because despite decades of recovery, many still carry those experiences with them as they age. So the question becomes, what happens when the recovery generation itself begins confronting the realities of aging? What happens when someone who spent decades rebuilding their life can no longer safely live alone? What happens when they begin needing help at home? Help with medication, help with cooking, help bathing, help getting to medical appointments or to meetings? What happens when someone who fought so hard to build a stable recovery life now needs support simply to remain independent? This is where I begin thinking more deeply about the need for my two-track approach for people aging in recovery, because not everyone needs the same level of care. I've been talking about this, but I think it's worth reiterating. One track involves people who are still capable of living independently, but who require support services in order to safely age in place. That's where the concept for Never Alone home care services comes in. Recovery-informed home attendance, home health aides, companionship, medication management, support services specifically designed for older adults living in long-term recovery. Not simply treating them as elderly patients, but understanding their recovery. Not simply treating them as elderly patients, but understanding their recovery journey as part of who they are. But there's another piece to this that I think is equally important. The people in recovery that are not simply service recipients, that they are not simply patient, that they are not disposable. In my opinion, they are a tremendously undervalued and squandered human resource. These are people with decades of lived experience, people who survived addiction, survived chaos, survived despair, survived stigma, and still managed to rebuild their lives. That kind of experience has value. That kind of experience creates wisdom, perspective, strength, hope. And I believe many older adults aging in recovery still have an enormous amount to contribute to younger people now struggling with addiction themselves. Their stories matter. Their recovery matters. Their presence matters. In many ways, they represent living proof that long-term recovery is possible. Not simply short-term abstinence, but decades of transformation. But eventually, some people require more structure, assisted living, residential care, nursing home care, and that creates another issue entirely, because traditional elder care environments often do not understand recovery culture. They may not understand peer support, recovery language, the importance of recovery community, or the emotional and spiritual dimensions of long-term recovery. And that's where ARRM comes in, Aging in Recovery Residential Model, a recovery-informed residential model for older adults who can no longer safely live independently but whose recovery still needs to be protected, respected, and understood. Because recovery does not end at retirement age. If anything, aging may make recovery even more important. People begin facing isolation, loss, physical decline, loneliness, fear, health problems, grief, and cognitive diminishing. And all of these things can affect recovery. And honestly, I think society still tends to misunderstand recovery itself. Many systems still focus almost entirely on active addiction and short-term abstinence. But long-term recovery is something much deeper. It is decades of rebuilding an entire human life: mind, body, relationships, purpose, identity, community. And aging affects every one of those dimensions. So when people ask me whether there's really room for this conversation right now, my answer is hell yeah. Because this conversation is not separate from American history. It is American history. That same generation that lived through the social upheaval, the drug epidemics, the recovery movement, the AIDS epidemic is now growing old. And I believe we have both a moral responsibility and a social responsibility to stop treating this population as invisible. Because if we create systems that support older adults aging in recovery, if we help them remain connected, stable, supported, and valued, then their experience and strength can continue helping other people find recovery too. And maybe that is the larger lesson here. Aging in recovery is not simply about services. It is about dignity, community, purpose, connection, and making sure that the very generation that survived the chaos, addiction, and upheaval of the 1960s, 70s, and 80s does not grow old and forgotten or invisible. If you found this information valuable, please feel free to like and subscribe for more insights.
This has been Aging in Recovery. If this topic matters to you, please stay with us as we continue to explore this emerging field.